welcome everyone. Today we have a special guest, so I'm very excited that Margarita Bahenke is with us today, who's going to talk about a very interesting report that was commissioned by Viatris. She comes from New Angle Consulting. So I think there was, yes, so no, this is the agenda. So Margarita's will present, and then we'll have questions and answers. Then we'll have a little satisfaction survey, and then we'll talk a little bit about some follow-up things for Work Package 9. So with that, I will turn it over to Margarita.
Okay.
Thank you.
Thank you very much, Christine, and good afternoon to everyone. I believe everyone is in the afternoon time zone already. So yes, I will present the main conclusions of this study that we did, and it was sponsored by Viatris. So let me share my screen. I was also going to comment that I know how these work package groups work, because I'm also in an European consortium. So we also have work packages. Ours is on health, the exchange format for health data. So I know how this typically works. So I believe you're seeing my screen. I just want to let me just put this bigger in presentation mode. It's taking a little bit. I don't know why. Okay, it should be almost good.
Perfect. Thank you so much.
Okay, great. So again, this study is basically on strengthening patient access to off-patent medicines in Europe. Actually, the focus was off-patent medicines and off-patent antibiotics, and it was, as Christine already said, it was sponsored by Viatris. Just to give a bit overview, it's too crowded the page, but I won't go through all the details, but just to give a little bit of context. So the study, we did two things in the study. We did a quantitative part, and that quantitative part was the study of the evolution of patent antibiotic prices, and compare the price evolution with macroeconomic indicators and production costs in the industry. We did the study and then we also reviewed policies that have been done, pricing policies, and then we proposed some recommendations, based on some initiatives that at times are already underway, and mostly have been inspired by literature and by some information available. So we covered 16 countries, 14 from European Union, 2 and Switzerland and the United Kingdom. And as I said, we used the prices of off-patent antibiotic, retail prices, ex-factory prices, and we used a basket of the 10 molecules with the greatest market share in each country. So at the end, our basket had 30 molecules, and those were the ones that we analyzed. And then we compared, as I said, prices with costs, and we used macroeconomic indicators, the harmonized index of consumer prices, the general one, and the food and non-alcoholic beverages. And then some production indicators, like the industrial producer price index, as a proxy of production costs, and then some of the production costs, like industrial labor cost index, then electricity and gas consumption cost consumption index, and aluminum and paper. So several of the costs that impact the cost of the industry. So our study, the quantitative analysis, went from 2020 to 2024, considering 2020 as the base year, and we have worked an index based on that base year. So just coming to the general conclusion, then you'll see this in the following slides, is that off-patent antibiotic prices have gone down by 10.4% since 2020, although costs have all increased. So we always see a gap, and you'll see a gap in every slide. In this case, we are seeing the harmonized consumer price index, 23.4% increase for the general price index and 30% increase for the food and non-alcoholic beverages index. So quite a gap, and going in different directions. Right, let me see. Okay. When we look at the producer price index or the labor cost index, we see the same kind of trend, and actually not very different numbers. So again, the orange line is always the same, and it refers to the evolution of the off-patent antibiotic basket, and an increase in 25.7% in labor costs, and an increase in the industrial producer price index of 31.6% over the same periods. Electricity and gas, here although the graph doesn't show like that because of the scale, the differences are even greater. So we have the electricity cost index grew by 62.3%, while natural consumption gas 88.4%. And as you can see, in 2022, it grew 173.2%, and that was the lowest point on the prices of patent antibiotics. So here, clearly, in 2022, a very big gap in one of a key input for the industry. And then aluminum and paper production prices, the same kind of trends. Aluminum went up by 40%, and paper by 24.3%. So the baseline message here is that price has been subject to many pressures. It comes from all the pricing policies that are in place and that are applied usually both to patent and off-patent medicines, and that affects the margins quite a lot when you see these high cost evolutions in the market. So again, this brings some viability and availability challenges for patient access for antibiotics. So in general, costs increased quite a lot. The lowest increase is 24% for paper, all others are greater, and prices went down by 10.4%. So what we also saw, and probably as a consequence of these pressures, is that there was pharmaceutical market consolidation, and there were quite a significant number of withdrawals of antibiotics from the market. And from 2020 to 2024, we had about 20% of the antibiotics were withdrawn from the market, and many of them are part of the Union list of critical medicines. So it becomes being a worry. Then there are medicine shortages, and many have been highlighted in the EU, like amoxicillin and others that are usually always in shortages. So this brings some supply challenges and that need to be addressed. And so what we looked at, and when we looked at the policy recommendations, what we looked at is that what we have seen is that there has been a big focus on pricing, which has been good for the budgets of the health budgets of the countries, and to guarantee access to to millions of patients. So off-patent medicines and off-patent antibiotics are the main therapy for many patients. So that is very important. But to protect this access model, it's needed to look at pricing and procurement systems and leave a short-term vision to a more longer-term vision. And we feel that's the way to enable economic viability of medicines, which will protect availability and patient access. So, and we have seen mainly in antibiotics in our study and in all the literature we reviewed that there are many initiatives underway, mainly regarding antibiotics. And antibiotics are a big challenge because of antimicrobial resistance. I know it's the core of your work in this work package. So, these things then matter because they can make a difference. Let me also say that the medicines that are, most that are important because of resistance or that have short spectrum usually are low value, as you know, low value, low volume medicines, which means that they are usually the first ones to become unviable. And, if they are withdrawn, then you have to use wider spectrum choices. And of course, that has an impact on AMR. So, it's all this that I know it's been worked off, and Sweden is a case. So, Sweden, the Nordic collaboration. So I think there's some good cases on the way. So we, at the end of our analysis, which is much extensive than what you have seen here, and the study is available in Medicines for Europe and in Beatrice sites, so you can always reach to it, and if you're interested in some more detail. But when we were crafting the recommendations, we looked at some policy goals that we thought were critical, and we highlight 4. One is to ensure a minimum viable economics model for reliable and stable supply of off-patent medicines, namely antibiotics. Preserve competition. Competition is important. We thought of, minimum of 3 suppliers per molecule. Because what happens, and especially in procurement, the race to the bottom makes risks leaving you with one supplier, and if it's one supplier, he owns all the power, so it becomes kind of risky. So preserving this competition and enough suppliers in the market is something to keep in mind when drafting policy goals. And stay budget sustainable, of course. Now health budgets are important, and it's the only way to also guarantee access to patients. So maybe some reforms are not for all antibiotics, maybe are for critical medicines, and then each country has their own challenges. So, there's a lot of frames in this process that need to be aligned. And of course, align with stewardship. So no incentives to overuse antibiotics. Whatever it is thought, this has also to be in mind. So we have some more. I won't say many more. We have some more policy recommendations in the reports. I've brought here the ones that seemed, most relevant. One is price indexation. So consider prices being automatic adjusted based on inflation or on other meaningful and agreed upon cost indices, like, production price index or some cost index that makes sense to and can be implemented and to support the viability and patient access. Then minimum prices, don't allow medicine prices to fall below defined floor level. This also, limits the race to the bottom that I talked about before. and it allows to ensure sustainable production and avoid, market distortions. Again, race to the bottom, leaving only one supplier and a lot of dependency on that supplier, making the supply chain, much less reliable. Tiered pricing models. So usually it has been used to lower prices, but it could also be used to make adjustments based on competition. So to allow some level of competition in the market, and working on the price based on that competition. That another proposal is the volume-linked reimbursement approach and revenue guarantees, like Sweden has already experimented. And this could be quite interesting. It's good because it preserves stewardship. It's no volume-linked bonuses. It's important for those low volume, low margin medicines that I talked before, because those are the ones that usually are not in the withdraw from the markets, especially in smaller markets, and that was one of the challenges in Sweden. So, create a baseline revenue for availability, and then, price on top of that. And then there are a lot of measures that can come from here. But the baseline is that you create a baseline revenue is guaranteed to assure availability. So this is one measure that could be interesting. It's not all, it doesn't fit all cases, but it fits some cases. So, there's never a one size fits all. And then reduce administrative and regulatory burdens. Those can be of many types. It can be harmonized spec size, lower barriers to market entry and re-entry, imagine reduce or eliminate re-entry fees, and also guide regulatory transitions through impact assessments, because here we were looking very much at off-patent medicines, and they are usually, the impact is greater because the margins are smaller. So any regulations like the new environmental regulations might hurt more this type of medicines, the off-patent medicines. Then procurement. Although we didn't analyze hospital prices, we did look at the procurement policies that were following. And although, governments are changing here as well, but there's still a lot of procurement that is only awarding a single tender for all the supply. And even when it allows multiple winner tenders, it just goes to the others after if the first one can't supply, which is very hard because you have previsibility is important in the business to make sure there is availability. So we think procurement systems should consider things such as multi-winner tenders, clear criteria that is non-price, and then those can be linked to supply reliability or to environmental standards. So at the same time, you improve issues, some of the critical issues in the market. Increase demand predictability, because if it is more clear what hospitals, mainly hospitals, are buying, it's easier for the industry to adjust production and to plan for production. And then diversify supply sources, try not to rely on only one single supplier of API, and medicines. And assure collaboration and collective responsibility. We think this is it's kind of a hard journey, to balance viability and availability for antibiotics or for any other off-patent medicines. So it needs to be collaborative, and it needs to, as well as possible, align all the interests and the goals of these various stakeholders, where you are part of them as well. So But taking this longer-term view is what we think is really critical. So just in summary, so the study, as I said, highlights the sustainability of off-patent antibiotics, and we use it as a case study for off-patent medicines in general, which are under a significant strain in Europe. Let me just say, when you see shortages, it's when the problem is already there. So it really needs to be tackled. So price reductions and this vicious cycle of price reductions is probably what brought us here. And it delivered important savings, as I said before, but it also progressively eroded the economic viability of many critical molecules. These mechanisms, as you know, that are used mostly, they are used for any medicine, external prices, internal reference prices, clawbacks, paybacks, freezes. When you're already working on a very thin margin, they have a cost, and that cost is long-term supply resilience. Again, as I said, the European policy debate has already been discussing critical off-patent medicines, particularly antibiotics, and they cannot be subject to minimization. So I think they have to be seen as a strategic public health asset, and think the policy around that to guarantee effectiveness of health systems, but also access and preventing the further spread of antimicrobial resistance. So bottom line, ensure long-term sustainability of off-patent medicines, as I said, required a shift from short-term to longer-term views and longer-term policies and well-thought policies. So that was our main conclusion as we did this study. So thank you very much. I'm open to questions if you'd like to ask me anything.